Looksmaxxing is self-improvement.
Looksmaxing is a form of excellence.
Behavior that's beyond baffling.
I don't want you to be hurting yourself.
Of course.
I feel like you are.
Telling young guys that life is hopeless.
Say you smash them hard enough to cause some trauma, you have no control over how these bones are going to heal and remodel.
This video starts with a mirror, but it ends with a warning. Because in Looksmaxing, the most dangerous thing being reshaped may not be your face. It may be your brain. A young man starts with skincare, then hair, then gym, then jawline exercises, then facial symmetry, then canthal tilt, then hunter eyes, then facial ratings, then videos telling him that women only want the top 10% of men. And slowly, without realizing it, he stops asking, how can I look better? And starts believing, if I do not look a certain way, my life is already over. That's the shift from self-improvement to surveillance, from confidence to compulsion. And this is where Looksmaxing becomes clinically relevant. I'm Dr. Sanil Rege, consultant psychiatrist and educator. This is something I'm increasingly seeing coming up with young people in clinical practice. Looksmaxing, the red pill, the black pill, body dysmorphic thinking, and the way appearance anxiety can become a dopamine trap. In this video, we'll look at why these ideas can become so compelling, how they shape self-worth and threat perception, and why the brain can start treating appearance like a problem that can never be solved. This is not a video mocking young men for caring about how they look. Most people care about appearance. The more relevant question is, when does self-improvement stop returning you to life and start pulling you away from it? And by the end of this video, I want to give you a simple framework: self-care, optimization, and ideology, and how they all differ. Because once you can separate those three, you can see why some forms of Looksmaxing are harmless, some are risky, and some can become psychologically dangerous. So first, let's start with the basics. What is Looksmaxing? Looksmaxing means trying to maximize your physical appearance. At the mild end, it can mean ordinary self-care. A better haircut, better clothes, exercise, skincare, sleep, posture, dental care. Learning how to present yourself. There's nothing wrong with that. In fact, for many people, improving appearance can improve agency and autonomy. You take care of yourself, you feel more organized, you feel more confident. And that's important for young people. The problem begins when appearance stops being one part of your life and becomes the explanation for your entire life. It's an explanation for why you're lonely, why dating's hard, why you were rejected, why you feel invisible, why you feel ashamed. And this is where we need some background, because Looksmaxing did not emerge only from grooming culture. It has roots in online male forums, including Incel spaces, and then moved into mainstream platforms like TikTok, Instagram, and YouTube. And I've no doubt that you've seen lots of this recently. Content creators now talk about facial harmony, bone structure, masculinity, canthal tilt, zygomatic projection, the width of the jaw, and ascending aesthetically, often with little or no formal cosmetic or medical training. Some would argue that this remains in the Softmaxxing zone. Softmaxxing is hygiene, fitness, grooming, skincare, clothes. But hardmaxxing moves into more extreme territory. Cosmetic procedures, unregulated substances, steroid use, extreme dieting, and in some online spaces, dangerous practices such as bone smashing, where people deliberately hit the face with blunt objects believing it may reshape bone structure. Medical sources have warned about risks such as fractures, misalignment, nerve injury, deformity, and visual complications. As a clinician, I recognize that this conversation needs nuance. Because if I simply say, look, Looksmaxing is bad, I'm going to lose the audience, the patient, the young man in front of me. Because the explanation is, what's wrong with the gym, skincare, and trying to look better? And he's right. That part is not the issue. The issue is when self-care becomes a belief system. And to understand the belief system, we need to define the concepts of the red pill and the black pill. The red pill comes from the Matrix, the idea of waking up to a hidden truth. So in online male spaces, Red pill content often claims to reveal the truth about dating, attraction, masculinity, status, and relationships. Some of it is framed as self-improvement. Become fitter, become more confident, stop being passive, build your career, develop social skills. But it also becomes adversarial, especially when it reduces women, relationships, and masculinity into rigid rules. The black pill is darker. The black pill says even self-improvement will not save you. It claims that appearance, height, bone structure, facial ratios, and genetics determine your social and romantic fate. In black pill thinking, your face is not one factor. Your face is your destiny. Your face, your bone structure, your jaw become your worth, your identity. And this is where the brain becomes vulnerable. Because the black pill gives a young man something that can feel like relief. It gives him certainty. So for example, if someone's lonely, rejected, bullied, anxious, depressed, socially inexperienced, shy, life feels confusing. There are too many possible explanations. It could be anxiety or social anxiety. Maybe I'm depressed, maybe I'm neurodivergent, maybe dating's difficult. All of these multiple explanations, that's complicated, that's exhausting. The black pill simplifies everything. It says no, it is your face. And the brain says, at least now I know. My distress now has an explanation. That's why hopeless ideologies are powerful. Not because they make people happy, but because they reduce uncertainty. I've covered this concept in the video on the function of the brain as a predictive organ. The brain did not evolve to make you happy. The brain evolved to reduce uncertainty to make the world more predictable. So for a distressed brain, a painful certainty can still feel safer than an open, unanswered question. You've seen the meme. False reassurance is often preferred to an inconvenient truth. Now let's connect this to psychiatry. One of the closest clinical overlaps is body dysmorphic disorder. Body dysmorphic disorder is not vanity. It's not simply about caring too much about looks. It's a condition included in the DSM-5 where a person becomes preoccupied with a perceived defect in appearance, which may not be noticeable to others or may appear slight. The concern becomes overwhelming, repetitive, and impairing, often leading to checking, comparing, reassurance seeking, camouflage, avoidance, depression, and social isolation. The key aspect here is impairment, because someone can care about their appearance and not have body dysmorphic disorder. The clinical concern arises when it starts affecting the person's life. Repetitive scrutiny, repetitive checking. Do I look okay? Is my jaw recessed? Is my skin bad? Would surgery fix this? And every answer lasts only a few minutes. Then the doubt returns, and the checking and scrutiny continues. That's the loop. And this is where dopamine comes in, because dopamine is about motivation, about what grabs the brain's attention, prediction, and learning. It tells the brain, this matters, pay attention. So the person looks in the mirror because they feel anxious. For a moment, checking gives relief. Then the anxiety returns, so they check again. So the brain learns, when I feel uncertain about my appearance, I must check. That tiny relief becomes the reward. Relief is addictive. This is the dopamine trap of Looksmaxing. The person thinks they're solving a problem, but the brain is learning a ritual. The mirror, scan, scrutinize, compare, feel anxious, check again, research the solution, watch the video, look for the flaw, feel worse, repeat. And the social media algorithm pours fuel on the loop, because once you watch one video on jawline exercises, you may get another on facial ratios, then another on why dating apps are impossible, then another on signs you're genetically doomed, another on cosmetic surgery, then about personality. This content becomes an attentional environment. It teaches the brain what to notice. And once the brain starts noticing defects, it does not stop at one. It may start at the skin, move to the jaw, the hairline, the eyes, nose, height, body fat, muscle, on and on. That's why reassurance here does not work. Someone might say, you look fine, but the brain is not asking a normal question. It's running a threat model. If this feature is wrong, if I notice this, will I be rejected? If I'm rejected, I'm worthless. If I'm worthless, there is no future. So the face becomes a symbol of acceptance or rejection. Now here is the dangerous part. Looksmaxing can turn body dysmorphic thinking into a community. A person no longer sits alone with the mirror. He uploads his picture, receives ratings. He's told he's a 4, a 5, a normie, subhuman, failed, invisible. He's given pseudo-scientific explanations: facial third, zygomatic projection, forward growth, jaw width, facial harmony. And because these sound precise, a teenage boy who feels insecure may think, finally, someone is telling me the truth. But often what he's receiving is not the truth. It is humiliation dressed as precision. And once humiliation is repeated enough, it fuses with the identity. The brain now organizes around feeling humiliated. This is especially important for young men because appearance anxiety in men is often hidden under performance language. What I mean by that is words such as optimize, ascend, maximize, dominate, improve, compete. Clinicians, parents, partners need to hear those phrases differently. We might dismiss them as internet slang, but these may be markers of depression, body dysmorphic disorder, social anxiety, trauma, obsessive thinking, isolation. So how do we know, or how do we pick up when self-improvement has become a trap? Here is the framework. I'll give you 5 markers. 1, time. How much of the day is consumed by appearance checking? 2, avoidance. What has the person stopped doing? Socializing, dating, working, studying. 3, rituals. Does the behavior feel optional, a choice, or is it compulsory? Can they leave the house without checking? Can they sit with uncertainty? Can they tolerate a bad photograph? 4th, insights. Can they say, maybe I'm overvaluing this? Or is the belief fixed? In body dysmorphic disorder, insight can range from good to poor, and in some cases the belief can become delusional in intensity. Firm, fixed, unshakable. And number 5, escalation. Is the person moving from care to harm, from gym to steroid misuse, from skincare to compulsive procedures? Healthy self-improvement comes from respect. Compulsive Looksmaxing often comes from contempt and anger. So how do we approach this? What helps? The first important aspect is to ensure that we do not employ mockery. Mockery pushes people deeper into the community. So if a young man is absorbed in Looksmaxing content, saying that it's ridiculous will usually fail. It's no different to someone using substances. The substance is now a solution for an underlying deeper problem. The content here is doing something for this young man. It's giving him an explanation, perhaps control, belonging, a language for pain and rejection. It's giving the young man a direction. The problem is that the direction keeps returning him to the same wound. So we begin with curiosity, not why are you watching this rubbish, but rather help me understand what this content does for you, or what does this content give you? Do you feel better or worse after watching it? What need of yours does it meet? Often the needs are about longing, connection, being wanted, being seen. The jawline, the face, they're symbols of something deeper. In body dysmorphic disorder, psychological treatment often involves cognitive behavioral therapy and exposure response prevention, reducing checking, reducing reassurance seeking, working with mirror use, testing predictions, facing avoided situations, and returning to meaningful activities before the person feels physically perfect. In some cases, medication also has a role, particularly where symptoms overlap with obsessive, compulsive, or depressive features. Here, high-dose SSRIs are evidence-based. Now let's return to the black pill. The black pill is dangerous because it trains selective attention. It teaches the brain to collect evidence of defeat. So a dating rejection becomes proof of hopelessness. A woman not replying becomes proof. A photo from a bad angle, a more attractive man getting attention, a joke at school, a lonely weekend. All of this is proof that pulls the individual to the same prediction, I am doomed. It's a depressive prediction. The concern is that the black pill often presents itself as a brutal truth. And what's needed here is to help the person recognize that they're a person with a nervous system, a history, attachment needs, habits, fears, skills, blind spots, relationships, values, and choices. Help them understand that there is a broader map. This map gives individuals more room to move rather than explain their life through a single black pill. So let me summarize all of this for you. Looksmaxing sits on a spectrum. At one end, it's ordinary self-care. At the other, it can become compulsion. The relevance to psychiatry is its relationship with body dysmorphic disorder. The red pill says it is revealing hidden truths about dating and status. The black pill says your genetics have already decided your life. Looksmaxing becomes dangerous when it fuses with the black pill and teaches the brain that appearance is destiny. The clinical warning signs are time avoidance rituals, poor insight, and escalation. That's the dopamine trap. And the therapeutic approach is not to shame the concern, it's to widen the frame. So there's one thing to take from this video, it's this. Self-improvement should return you to life. If it keeps you pulling away from life, it has become a loop. And loops can be understood. They can be interrupted. They can be treated. I'm Dr. Sanil Rege, and you're watching the Dr. Rege channel. If this was useful, like and subscribe, and share it with someone who might be quietly caught in this loop. And if you'd like to support the channel, membership gives you early access to videos, priority comments, badges, and emojis. It's just one way to be part of the community and support more of my work. For psychiatrists and clinicians who want deeper psychiatry education, the Academy by Psychiatry explores these presentations in more depth. I look forward to seeing you in the next video. Until then, stay curious. Bye-bye.